welcome. You're watching Times Now with me, Priya Bahal, and the issue that we are going to talk about right now is something that brings back very bad memories from a few years ago of coronavirus. 5 years after the onset of COVID-19 pandemic, China is facing yet another health challenge, which happens to be eerily similar to coronavirus. A rapid outbreak of the human metapneumovirus, or HMPV. Reports suggest that respiratory illnesses are spreading rapidly in China, leaving hospitals and crematoriums overwhelmed. In fact, several videos circulating on social media, which cannot be independently verified by Times Now, have shown how hospitals are struggling to manage the crowds amidst the spike in respiratory illnesses in the country. The concern, however, remains over HMPV, the virus that is now causing a surge in respiratory illnesses in China. Let's tell you, first of all, more about this particular virus. Now, look at what is HMPV. It is a germ identified as human metapneumovirus. That is what we're talking about, that China is dealing with. It is a significant cause of acute respiratory infections. Remember, respiratory tract is also what coronavirus was targeting. It spreads through contact, coughing, and sneezing. Yet another parallel that you can draw with COVID-19. It can lead to upper and lower respiratory illnesses. Typically spreads during winter and spring months. And given that it is winter right now, one can understand why it is spreading so fast. It coincides with prevalence of flu and other viruses, which one would assume makes it even more difficult to be identified and detected. Coming to identification, how does this one know that they are suffering from HMPV? Here are some of the symptoms that the patient of this virus displays. Runny nose, stuffy nose, or sore throat. Very, very similar to flu symptoms. Some patients may experience wheezing as well. Then it may also experience a shortness of breath, usually associated with any respiratory tract infection. Rashes may develop in some specific cases. All this information, remember, is only emerging via social media platforms and reports that are coming out of China, that we are learning and gathering all this information. We know that communication and verifying communication and information coming from China is extremely difficult, next to impossible. But who is really at the most risk from HMPV? Worrisome it is that children aged 5 years or younger are one of the groups. Remember, in India, COVID, this age group is a group that had managed to evade threat from that. Prevalent among elderly individuals as well. People with weakened immunity are the ones who also are at risk, and those undergoing chemotherapy. Basically, anybody who has a reduced immune system and the ability to battle viruses, recipients of organ transplants, yet another people who would fall in that category. Remember, we spoke about comorbidities. In case of COVID, they were the people who were more susceptible to contracting this virus. So do we need to worry about this? Is there something that is remotely similar to coronavirus that is now on the anvil? To help us answer those questions, I'm now joined by Dr. Saumitra Rawat, Chairman and Head of Surgical Gastroenterology at SGR Hospital. 40 days, sir, if I could ask you, a lot of the symptoms that we have described are very similar to COVID, or for that matter, even common flu. How is one to figure out whether they need to go for a test, if there is any test in particular for HMPV?
I think, thank you very much, Priya, for inviting me. Like with any viruses or the change of viruses during the COVID time, I think we need to complete the whole conundrum. We need to see whether there is any change in transmissibility, whether the transmissibility is similar to COVID. That is number one. Number two, we need to see the severity of infection. So severity of infection means how many percentage of patient with this kind of virus is getting very severe symptoms or requiring a ICU. Third thing we need to also understand what are the implication of this particular virus on the COVID vaccine, which majority of the population have. Fourth thing is the testing. And fifth is the treatment. So I'm pretty sure in due course of time, these five things will come, and that is how we will get wiser.
But from whatever information we have right now, sir, do we need to worry at all, or is it something that is endemic to China itself?
I think we need to be cautious. We need not have to have a panic, but we need to be very cautious, and we need to have a look at it at five parameters which I talked about. Like in COVID also, initially there was a alpha, beta, gamma, epsilon, delta, delta plus. So there was a mutation there as well. So we need to see that, how this particular virus is behaving, and symptoms are similar to the flu, which we commonly see in winters.
Okay, so let's say somebody in my family is exhibiting symptoms of flu. So what should be my course of action from there?
Course of action would be, first of all, the most important thing is take the treatment as you take it for flu. Go and meet your local general practitioner or a physician and see how it behaves. Majority of the time, the common flu or the influenza virus or any other flu virus, they get better with time. But the most important thing, which you have already mentioned, the important thing are patients who have got a comorbidity, they have to be extra cautious. Those patients who are diabetic or on immunosuppression or old age having other comorbidities, like you mentioned, patient who had a transplant where the immunity is low, those are the patients who need to be extra careful.
And what about children, sir? Because, in both the waves of COVID, we saw that thankfully children were not too much affected. But one of the risk categories in HMPV happened to be children younger than 5 years old.
Absolutely. The risk factors for this particular is children more than 5 years, elderly population, and patient with comorbidities.
Okay. Is there anything in particular that needs to be done when you take care of children? Because if it spreads by coughing and, sneezing and things like that, now it's winter vacation, kids will go out, they will intermingle with other kids. Anything that you would like to advise the parents as a precautionary measure?
I think
masks come out?
Precautionary measure is like, you used to do for COVID is the same precautionary measure we need to take that, if somebody is symptomatic, try to isolate them. And obviously, if somebody is having a symptoms, it would be advisable to wear the mask and keep them isolated, see their behavior in a day or 2 or 3 days, and majority of time the common flu symptom will settle down in due course of time.
And what exactly is the one thing to look out for to set the alarm bells ringing?
I think alarm bell ringing is same as it was in COVID, that, the number of, we need to see the infectivity, how much infective this particular virus is. Obviously, like with COVID, testing, tracking, isolate, treatment, and containment. I think for any viruses, these are the policy we need to adapt.
We are also opening our phone lines for our viewers in case they have any queries about this, because the memories of COVID are still fresh. So any surge in number of patients, this modus operandi of this particular virus happens to be very similar, quite overlapping with what happened with coronavirus earlier, as Dr. Rawat was telling us. We still don't know a lot of things about this. But talking about identification, apart from the symptoms, do we have definitive tests in India to be able to establish this particular infection?
I think that is what our testing agency will tell us. I think when you have a respiratory biofire, I'm pretty sure that this would be added in a respiratory biofire. And as I said, that it depends on how much the population is involved. And in China also, as it is happening at the moment, I think what they are also saying that it is a common kind of flu virus which is there in the winters. But then the same thing started with COVID. I think we need to be extra cautious. And the 5 parameter, which I said in the beginning, we need to be cautious, but let's not panic.
Okay, so the couple of things that emerge from this right now, that it seems to be endemic to China itself. China so far is saying that there is nothing to worry about, that it is just like any other flu which can easily be cured. India hasn't seen any particular instance of this, so our preparation will also depend on the scale, if at all there is a similar outbreak. But another thing that we saw in COVID was, blocking off entry of citizens who were coming from infected cities and all. Given the fact that it's so difficult to corroborate whatever information comes out of China, what would you think would take the government to start thinking about those measures, if at all?
I think those measures will come in play only when, we have the same virus illness in India and it is becoming epidemic. I think that is the thing. And the other thing is that, how the symptoms are and in how many patients you are having a severe illness. So these are the things we need to look, and that is how the modalities will develop, like it developed in COVID.
Are there any patients in your knowledge of HMPV, whether in India or in any other country apart from China?
I think, Priya, I think the media will know it sooner than I would know. But, I don't have any idea.
Right.
But then we will know soon. And I think the 5 things which I said in the beginning, that, transmissibility, severity, and quite a lot, majority of Indian population has been vaccinated, and quite a lot of us, like, I'm a doctor working in a hospital. So,
Right.
I take a regular flu vaccine.
We'll talk about preventive steps also, sir, but I'm now joined by a caller from Rohtak. Captain Jaspal, please go on with your query.
Good afternoon. Doctor, my query is, I'm around 80-year-old, retired army officer. Do you think sharing the newspapers, because in this age you share a couple of newspapers with your friends, will it transmit? Thank you.
I think if you are sharing a newspaper with a healthy friend of yours, it is not a problem. But then, if somebody is having a flu symptoms, avoid sharing newspaper. It's the same protocol we use for COVID.
Okay, sir, one quick question before we wrap this up. What about people who are traveling to China from India for work? Is there anything in terms of prevention that they can do?
I think prevention is the same thing, the 4 things which we talked about COVID only.
Nothing in terms of medication, like preventive medication?
I think at the moment there is nothing like, because this is a new virus. I think the prevention
Right.
Protocol will come in due course of time. But the 2 things which is common for all the viruses is, you need to
Yes.
keep cleaning your hand regularly if you are touching a shared surface. And
Right.
second thing is a mask.
All
This
right.
is what you can do.
Thank you, sir. Thank you so much for sharing your insights with us. Like it was in COVID, caution remains your